I would like to welcome everyone to today's FAST-TRAK Training Lab. Today's session is brought to you by DocShop Pro. DocShop Pro is an inventory management and supplies platform built for private practice podiatrists. My name is Tony. I'm the Traknet client trainer, and joining me today is Erica, who is one of our customer care representatives. In this webinar, we'll be covering questions which you as our clients have when using the Traknet program. I do want to let you know all users are in listen-only mode, so we can use the questions box to enter in any questions that you want to ask. And then this webinar will be recorded, and then following the webinar, it will be emailed to you. All right. I do want to make sure everyone's on our current Traknet version. Actually, that does not look like the correct version there, so I'll have to get that correct version for us. Give me just a moment. And then Erica, why don't you go ahead and start us off with our first question while I'm getting that correct version number here.
All right, no problem. The first question that we have here is, can holidays automatically be blocked on the scheduler?
Okay. Unfortunately, holidays are not able to be automatically blocked on the scheduler. And I'm just waiting for Traknet to come up here. There is a way to block days, so you can block the days that you want to have for the holidays, but they won't automatically block. And once Traknet comes up here, we'll log in and I'll show you how to block those days. All right, blocking days is done through the block days. And to block a day, we simply select the day that we want to have blocked, select the schedule that we want that day blocked on, and select a reason. So if it were holidays, if you want to put in a block for your all holidays, I would say add a reason to your system that is holidays. Or you can put it in for personal, whatever you want those, and add a comment. And then click Save. That blocks the entire day and prevents you from being able to schedule any appointments for that day. All right. I have the correct version number now, so let me go ahead and pop that up on the screen here real quick for everyone. Here we go. There's the correct version number, down at the bottom. Just want to check to make sure that you have that version. And the way we check that is we can just go to Help and either click Check for Application Updates, and that'll check for any updates, or click the About, and it'll tell you what version you're currently on. All right, Erica, are we ready for the next question?
Absolutely. The next question that we have here is, could you provide a run-through on how to process the end of the year Pqrs registry?
Okay, it sounds like the question's asking if we can provide a run-through on how to report the end of the year Pqrs to registries. Pqrs is reported through the different CPT codes used within Traknet for the measures that we recommend, and that's going to be going to your Pqrs report, running it for the specific length of time that you want to work with. So if you're doing it for a year, you'd want to set it for the year, selecting the registry report, and then just clicking Execute to run the report, and then export to export a file for sending over to your registry, and then you would send that information to your registry using their method that they have for sending that over.
All right, perfect. The next question here, for a new patient, why does it take several clicks several clicks after you finish your note to complete the CCV? Can you automate it?
Okay, from that question, it sounds like we might be talking about the CCDs. And there's a number of different CCDs that we'd be working with a patient. None of them are really specific to a new patient. So I'm going to assume we mean the CCD that we're going to be sending out to our patient. And once you've completed your note, you would go down to patient engagement, select your note, everything, send it out. If you already have your default template all set up, which I definitely recommend going through the CCD templates and making sure it's set up to relevant to your practice. If you already have all that set up, you can also click the CCDA button right here, and that's going to send that CCD over to the patient's Health Vault account so they can review it from there.
All right, perfect. Is Traknet certified for meaningful use?
Yes, Traknet is definitely certified for meaningful use. For reporting on your meaningful use, you'll need to have that certification number. So we can get that certification number from the Traknet's wiki page. I'm just going to go over here to the patient chart, go down to meaningful use in this little checkbox here. And on that meaningful use page, we'll find our Traknet 3.0 certification number. And that provides you the 2014 certification number for Traknet that you'll need for testing.
Okay, perfect. How can you add a default modifier to a treatment code?
Okay, adding a default modifier to a treatment code is done through Properties, and in Treatments, you would search for your treatment code that you want to add the modifier to, click Modify for the treatment, and then add the modifier. This is something where if you're not going to be using the modifier, I would say pretty much every time you're using the treatment code, I wouldn't recommend it because once you've added it to the treatment code, it will be added every time you use that treatment code. So whenever you use it on an encounter, that modifier is going to be added.
Okay, next question is how to add pharmacies in the patient's chart.
Okay, definitely. Now, when you write a prescription for a patient, it automatically adds the pharmacy you select to send it to the patient's chart. So one way is by writing your prescription. If you're not wanting to write a prescription, you just want to add their chosen pharmacy, we would go to Actions, Pharmacies, and there you can see the list of patient favorites they already have, or you can go over to your My Favorites or SureScripts tab and search for the pharmacy that they're going to use and add it by clicking the Add button. And I'll add it right to it.
Okay, and where does the default facility pull from on the scheduler?
Okay. On the scheduler, when the setting is set to use default facility, it's going to use the facility you logged into Traknet under. So right now I'm logged into Traknet under a facility called Office. When I go to make an appointment, I get the facility Office. If I go back and log into Traknet under a different facility, it's going to use that different facility that I'm logged into. So it pulls the facility that you logged in under for the default facility when you have that set.
All right, perfect. How to add a modifier to Traknet?
Okay, adding a modifier to Traknet is done through our Property tab. It's going to be under Property Values, right here for modifiers. We click Add, and then we can add the modifier. The value or code has to be specific to what you're working with. The description is not sent over, so the description can be whatever accurately describes the code you're adding to the system.
All right, and the next question here is how to remove a charge from a rejected claim.
Okay. By removing a charge from a rejected claim, I assume that you mean removing a charge from an invoice that has already had a claim sent out on it. In order to remove a charge from an invoice, it has to have no claim history and no payments made to the charge. So what you would need to do is to remove any claim history or payments. So for example, this has payments to it, no claim history. Let's see if I have some. Nope, no delete. So we'll go to a different one that's a better example here. Just trying to find one that I've got some claim history on. Here we go. So this one has a claim history where it was sent out. We cannot remove this treatment when there's claim history, so we would need to remove the claim history. And then we also have payments on this claim, so we would need to remove any payments from it as well. And then we can remove the treatment. We want to make sure to uncheck bill ready or we won't be able to remove anything from there. And then from there, it is the same process as resubmitting any claim. If you want to add a different code, you can go and resend the claim through your claim screen. So it comes back up here, it's ready to be resent. I apologize. Can you hear me now?
Yes,
Erica?
I can hear you good now.
All right, I apologize. I was informed that the audio went out on that. You have to remove that claim history, any claim history, any payment associated with treatment before you can remove the treatment. Once you've removed all the claim history, then you can remove the treatment. If you need to add a different treatment or resubmit the claim without that treatment, you would follow the normal process for sending out a claim. Are we ready for the next question?
Absolutely. Let's see here. How to complete Objective 10 for meaningful use.
Okay. Objective 10 for meaningful use is completed by reporting to 2 registries. We recommend reporting to 2 specialized registries. So it's going to be our wound care registries or our diabetic foot care registries, because in the ambulance syndromic surveillance data or the immunizations. So to report for those, we would click on our reports, specialized registries, and using the specialized registries tool, we can search for that ICD-10 codes that we're looking for. In this case, I'm going to use the MedExpress. We integrate completely with MedExpress for submitting this information. So you can click on that MedExpress and it'll bring up their ICD-10 codes that they're looking for the two registries they work with, the heel pain and flat foot. We search for our clients. In my database, I don't have any that have those codes. Once we got our list up, we would select them. So let's see if we can get some patients show up with notes. Nope. There we go. So it looks like I only have the hypertension in my system. The patients up, we'd select the patients that we want to work with. Click the export button, and that's going to export those CCDs to a file on your computer. So you'd want to select where you want those to go. Click the OK button. And it's going to produce the files that you've selected. With MedExpress being integrated, you can use the upload button, which is going to send them directly to MedExpress. With any other registries, you'll need to manually send them those CCDA files from that folder that you selected.
All right, thank you, Tony. How to hold patient charges?
Okay, setting a hold for patient charges is done under demographics. Under demographics, you would set when to hold the charges from and when to hold the charges to. So you'd set a date, and that'll hold the patient's charges for that period of time.
Okay, are we going to cover 2017 quality measures?
Okay, 2017 quality measures are covered in the webinar that Dr. Bass had covered quite extensively in the webinar Dr. Bass did, I believe it was a week and a half or 2 weeks before the end of the year. We can definitely send you out the link for that one. The ones we're currently recommending are included in there. Unfortunately, we don't have them completely set up in Traknet to go through how to do those in Traknet as of quite yet. So we can't go over how to complete them in Traknet as of yet. But the webinar goes over which ones he recommends, which ones we're recommending, and which ones we'll be implementing into Traknet. And from what I've seen on the webinar, it's going to be a similar submission process as to how it's previously been done through the different reports that we have.
Okay, thank you, Tony. Is there a report to show outstanding insurance balances?
Under Billing Dashboard on Reporting, the Pending Claims Report will show you any outstanding claim balances for the filters that you select. So you can select a specific date range, and it'll show you any outstanding balances for your insurances. And it'll show you, the summary will show you total amount, length of time per insurance. Detail will show you specifically what treatment codes they are for the outstanding balances.
All right. Perfect. Can patient eligibility be checked in Traknet?
Patient eligibility can be checked in Traknet. There's a prerequisite required for that. In order to check patient eligibility in Traknet, you must first be signed up with integrated eligibility through TriZetto Gateway. Once you're signed up with integrated eligibility through them, you can check your eligibility through your patient's insurance. So you'd go to your patient's primary insurance and click the Eligibility tab, and that's going to put a request through to Gateway to have that eligibility information downloaded into Traknet. And you'll be able to view that eligibility information here. And then you can also use our batch eligibility, which is on a scheduler. What this is going to do is it's going to pull all the eligibility information in for your patients for today and tomorrow, and I believe the day after that. For the batch eligibility, you will need to go to Tools and then to Options and add a batch eligibility provider to your Gateway EDI information. So that way it knows which provider to use to pull that eligibility information for.
All right, perfect. Thank you, Tony. How can you remove an adjustment that was added in error?
Okay. By an adjustment that was adding an error, I'm going to assume that we mean a adjustment payment like a provider payment. Moving any adjustments of those natures, just go to our billing dashboard, locate the adjustment that we want to remove, click the Remove button. Anytime we remove a payment, it is going to ask us for the reason for the removal. That's if we need to review, we'll be able to see why it was removed. Want to enter in that reason and click OK, and then it will be removed from Traknet.
Okay. Can Dragon Dictation be used with Traknet?
Dragon can be used with Traknet, however, not all Dragon functionality is going to work with Traknet. So there's certain commands in Dragon that will not work when you're dictating directly straight into Traknet. One way to get around that is to use the Dragon pad to dictate. You can dictate into the Dragon pad and then transfer that over to Traknet. And then, in my understanding, the Dragon Medical Dragon pad actually allows you to interact with the program itself while it's up. So there's different levels of functionality depending on which Dragon version you have. But Dragon does work with Traknet. It's just not adding. You just don't get all the functionality in Dragon straight through the Traknet program.
Okay. When does macro MIPS start?
Okay, the macro MIPS started on the 1st of January 2017. And it goes through the whole year. It's going to be continuing forward. And macro and MIPS are two different methods of reporting. So depending on your practice, it will depend on which one you'll be using. But it did start as of January 1st, 2017.
All right, thank you. Is DemandForce the only notification vendor fully supported by Traknet?
Okay. DemandForce is the only communication vendor we have a partnership with. It's the only one we work with. It's not the only one that is capable of working with Traknet. I know I've worked with clients that have other notification software, but at this current time, DemandForce is the only one we're partnering with at this time.
Okay, and we have a question here, how to avoid being penalized for macro MIPS?
Okay, for the 2017 year, for macro MIPS, they're kind of giving a sliding scale, kind of giving you a little bit of time to get into the changes. To avoid being penalized, there's three options you can take. There's a kind of a testing phase, which is where you submit some data for the year, and that can get you where you may avoid having a penalty. So you may just row kind of even slate, no penalty to your payments. There's a second option where you choose to report all the required data for 90 days, and reporting all the required data for 90 days will get you where you have no penalty. And then the possible positive payment adjustment. And then the third option is reporting for the full year. And reporting for the full year could earn you what I've been told is a modest payment adjustment. So you may receive a higher payment adjustment reporting for the full year. So those three methods will avoid being penalized for payments for that first year of the macro MIPS program.
All right, Tony. If you don't mind, can I have you to go over that first option just again? It was going in and out pretty bad during that first part of it.
Okay, I do apologize. I'm not sure what's up with the broadcast there, so I do apologize, everyone. The first is the testing option. You can submit some data for the year, maybe on one measure for a period throughout the year. That testing will help you avoid having a penalty. So you could come out with no penalty, just a zero adjustment. So you wouldn't have any negative penalties on it, but it's also not going to give you a positive adjustment on that.
All right, that was perfect. I heard it fully that time. The next question here is for meaningful use objective 8. How to complete this measure?
Okay, well, I can go over how to complete the measure for meaningful use objective 8. At this point, I'm not sure we're going to have any instances where we're going to use that. I'm not sure what the requirements for, like, as far as meaningful use will be for next year, but I got the kind of the gist that it may not be required to do that for the 2017 year. For objective 8, we need to send the patient a CCD within 4 days of their visit. That has to be within 4 days. So there's a couple things that are required for that. We have to have a patient email address, and we have to have the note signed and closed within that 4 days for it to count for meaningful use. And so we'll make a note. Once we've got our note signed and closed, we'll see that our patient engagement box lights up. We click on that, select our CCD that we're going to send, click Actions, and click Send to Portal. That's going to send that over to the Health Vault patient portal. The Health Vault's going to use the patient's email address and send them a message indicating that they have a new Health Vault message at Health Vault. They'll be able to click the link in there and get their new message. All right, looks like we're just about out of time here. All right. I want to let you guys know that our client success team will reach out to those whose questions were not answered after the webinar. I also want you guys to please join us again in another 2 weeks for the next FAST-TRAK training lab. I have a couple of resources I'm going to bring up on the screen here. We have our Traknet YouTube page. There's a lot of good videos at the Traknet YouTube page for going over different sections of Traknet. We also have all the webinars on the macro MIPS information from CPS there on our Traknet YouTube page. And we also have our Traknet wiki page link up. And thank you everyone for coming today, and have a wonderful week.